So the study is about the CAPTIVATE study, which is a phase 2 international multi-center study where we explored the combination of Ibrutinib, a BTK inhibitor, with venetoclax, a BCL2 inhibitor, as a frontline therapy in patients with chronic lymphocytic leukemia. Study design was a little bit complicated. It consisted of 2 different cohorts. They were not randomized, they were different cohorts. The first cohort was a so-called MRD, minimal residual disease cohort, where patients were treated with 3 months of Ibrutinib and then 12 months of the combination of Ibrutinib plus venetoclax, and then at the end of the 15 months of treatment, patients were randomized based on the level of undetectable MRD. Patients who reached undetectable MRD were randomized to either placebo, so to stop the treatment, or to continue Ibrutinib, while instead the patients who did not achieve undetectable MRD, they were randomized to continue either Ibrutinib as a continuous therapy or Ibrutinib plus venetoclax. The other arm, the other cohort was the so-called fixed duration cohort, where patients at the end of the 15 months all interrupted the treatment regardless the MRD status. So the results of the study, here at EHA, we presented the results, an update of the results of the patient who stopped the treatment, and to see actually how the patient would perform as a long-term outcome in a fixed duration manner of treatment, but also to see how the patient could be retreated when relapsing. And in this study that we presented, we have now a median follow-up of 5.5 years. And what we showed is that the responses were very durable. So roughly 3/4 of the patients still maintained a response after a median of 5.5 years. And there were differences, as we know, based on the genetic features of the patient, but in particular the unmutated patient with unmutated immunoglobulin genes that are considered to be the most difficult to treat, they still also maintain a response that was present in 68% of the patients after 5.5 years. Patients with aberration of the p53 genes, which are the very high risk patients, had a progression earlier, but still roughly around 50% of the patients were still in response after 5 years of treatment. So overall, every patient benefited from that. And what was more interesting is that those patients who relapsed could be retreated with either Ibrutinib alone or Ibrutinib plus venetoclax, achieving responses in most of the cases. The results are clinically very relevant because we show that we can provide a fixed duration treatment that is very simple to administer because it's all oral, and virtually all patients, including those with high-risk features, can benefit from it in terms of progression-free survival and durability of response. And in addition, we can also show that patients can be retreated using the same drugs, so we are not losing any option for our patient, but all options remains on the table when they need again treatment. Yeah, it's a longer follow-up. That's always what we want to see because we want to be reassured on the length and durability of the responses, and we want also to increase the number of patients who will eventually need the treatment, so really to have again consistent results in terms of retreatment.